20. Which has the highest frequency of non-genitourinary anomalies? Horseshoe kidney. Horseshoe kidney is also associated with GI tract and cardiac anomalies. So highest frequency of non-genitourinary anomalies is horseshoe kidney. Question number 21. Antenatal ultrasound shows right upper quadrant cystic structure. Day 3 ultrasound shows an anechoic cyst with hypoechoic inner lining and hypoechoic outer rim causing superior anterior displacement of the first and second portion of the duodenum without requiring lung dilatation, diagnosis, duplicating cyst. Because it is ultrasound shows anechoic cyst with double wall hypoechoic inner lining and hypoechoic outer rim, and then it has displacement of the first and second portion of the duodenum. So it's obviously a duplication cyst or anterior duplication cyst. 22. A 15-year-old boy investigated of polyuria with dyspnea. Such like a small right-sided pneumothorax and lung cysts are noted. Technology like hand cell cytosis. One finding is that history of polyuria in child shows Langhans cell cytosis. Other hint is lung cysts are noted. Another option C is lymphangiodematosis, but it is common in females. This is boy. 23. Which classification of atria/vista positioning related to the midline is associated with the lowest frequency of congenital heart defect? Solitus or levocardia has the lowest incidence frequency of congenital heart defect. Situs soleus or levocardia. 24. A 3-week-old boy with high output cardiac failure. High output cardiac failure is seen in hemangioendothelioma. Mass within the right upper quadrant. CT shows large atrial mass with central areas of low density occupying the entire left lobe of liver, most likely diagnosed hemangioendothelioma. 25. A 4-year-old girl has a proven first UTI. UTI is cultured and there is good response to antibiotics. You are advised to proceed with imaging. What should you recommend? No imaging, because it is the first UTI in a child and there is good response to antibiotics, so no imaging. 26. Which types of polycystic kidney disease is associated with the greatest degree of liver fibrosis? Juvenile autosomal recessive polycystic kidney disease has the greatest degree of liver fibrosis. Number 27. A 14-year-old boy, scapulotic lateral X-ray shows anterior wedging of the T8 to 10 vertebral body. Diagnosis: Scheuermann disease. Anterior wedging of the T8 to T10 vertebral body is seen in Scheuermann disease. Also shows Schmoll nodes. Question number 28. First feature: CT shows calcification within the right parietal gyri with equilateral skull thickening and enlargement of the caudate plexus. Diagnosis: Sturt-Weber syndrome. Calcification of gyral calcification, Sturt-Weber. 29. Not true regarding bone scintigraphy. It is more accurate in diagnosing skull fractures due to sutures. Scintigraphy, bone scintigraphy shows only fractures in rib and long bone. Why not in skull fracture? Because skulls have sutures. Sutures cannot be properly seen in bone scintigraphy, so it is used only for rib and long bone fractures. So it is not true regarding bone and scintigraphy. 30. A 3-year-old baby has shift of mediastinum to the right. The left hemithorax is filled with multiple cyst-like structures, paucity of bowel gases within the abdomen. Diagnosis: Pochalic hernia. 31. Which is not a feature of juvenile chronic arthritis? Rheumatoid factor positive. In juvenile chronic arthritis, there is no rheumatoid factor positive in children. Rest all are present because there are latent idiopathic spine involvement and oligoarthritis. 32. A 3-week-old baby with cough and difficulty in breathing. Such age shows complete obfuscation of the right hemithorax. There is rib crowding on the right and trachea is positioned to the right. Most likely cause mucus plugging. Because there is ipsilateral shift shows collapse of the lung. And as you know, the 3-week-old boy, cough and difficulty breathing. Such age shows complete obfuscation of the right hemithorax. Complete obfuscation of right hemithorax, and then there is rib crowding and trachea is positioned to the right, also shifted to the right. So ipsilateral shift of the trachea is seen due to collapse of the lung, right lung collapse, and cause of collapsed lung is mucus plugging. So most likely cause is mucus plugging. 33. In pediatric population, which condition is most likely to present as multiple pulmonary opacities? Arteriovenous malformation may show multiple pulmonary opacities. It is also associated with hereditary hemorrhagic telangiectasia. Multiple pulmonary opacities seen in arteriovenous malformation. 24. Lateral lung, no fracture. Lateral skull, no fracture, but shows simple multiple bones within the lymphatic suture, which is likely called hypoparathyroidism. There is multiple bones within the suture. This is called vermin bone. Vermin bone is seen in all options except for hypoparathyroidism. 35. Most common plain radiographic finding in malnutrition is normal. 36. 1-year-old girl with a harsh cough, fever, and stridor, associated with narrowing of the subglottic area, most likely diagnosis, croup. In croup, there is narrowing of subglottic area, and supraglottic area is narrowed in epiglottitis. Croup subglottic. 37. Neonate has bile stain vomiting post-feeding. The abdominal X-ray shows double bubble sign. Least likely underlying cause is pyloric stenosis. Because in pyloric stenosis, there will be single bubble. Only the air will be passing in the stomach, but not into the duodenum because there is pyloric stenosis. 38. Swelling on the left side of neck. Which feature makes brachial clefts more likely than cystohygroma? Extending between an external carotid artery and internal carotid artery shows cystic brachial clefts rather than cystohygroma. 39. Ultrasound shows hollow adenoids, a protrusion abdomen bilateral head nerve and marked dilated and tortoise ureter. The posterior is dilated and there is large distended thin walled bladder. At birth, the testicles are noted to be undescended and most likely diagnosed as belly syndrome. 40. Which cause of neonatal hydrocephalus is more likely to be communicating rather than non-communicating? Germinal matrix hemorrhage. Neonatal hydrocephalus due to germinal matrix hemorrhage is communicating. 41. Which feature makes Dandy Walker more likely than diagnosed than Diago malformation? Large posterior posture and Dandy Walker malformation. 42. Which finding indicate or Down syndrome is least likely to be seen? During atresia, it is seen after 22 weeks. Okay, this is a patient who is 18 weeks child, 18 weeks fetus. We do an abdominal ultrasound, and then we suspect Down syndrome. And which finding indicator of Down syndrome is likely to be seen in 18 weeks pregnancy is duodenal atresia, because duodenal atresia is seen after 22 weeks of pregnancy. 43. Duplication cyst of the gastrointestinal tract in neonates. Where is the common location? Ileum. Duplication cyst common location? Ileum. 44. It is not a feature of hypovolemia with CT. Reduced renal enhancement and not seen with hypovolemia and CT. Rest all are seen with hypovolemia, small hyperdense spleen, small bowel dilatation, collapsed IVC, and pancreatic enhancement are seen in hypovolemia, but not reduced renal enhancement. 45. Regarding tetromalacia, which treatment is correct, is associated with tracheoesophageal fistula. Tetromalacia associated with tracheoesophageal fistula. 46. 15-year-old girl with bilateral sclerosis of the premolar head, with loosened crescent paralleling the articular surface and subcortical cyst, diagnosed sickle cell disease. Now, slip upper femoral epiphysis is seen in 5 to 10 years of age, and this child is slip upper femoral epiphysis manifests as at 5 to 10 years of age, but this child is 15-year-old girl, and then she has bilateral sclerosis of femoral head with loosened crescent paralleling the articular surface, and subcortical cyst. So this shows destruction of the femoral head and seen in sickle cell disease. The most likely diagnosis. Question number 47. The normal anatomy of umbilical cord, there is 2 umbilical arteries and 1 umbilical vein. 2 umbilical arteries and 1 umbilical vein. 48. Sex associated snowman or cortic lead appearance or figure of 8 appearance, likely type anomalous pulmonary venous connection is present is supracardiac. Most common is supracardiac, total anomalous pulmonary venous connection or return. And this figure 8 appearance also can be seen. Snowman, cortic leaf, or figure of 8 appearance all are correct. 49. Which supports the diagnosis of Marfan syndrome or homocystinuria or aortic aneurysm? Seen in Marfan syndrome and not in homocystinuria. Just all are seen in both. Lens dislocation, mental retardation, osteoporosis, history of pulmonary emboli is seen in both Marfan syndrome and homocystinuria. But Marfan syndrome has aortic aneurysm because it has bicuspid aortic valve. 50. Anterior ultrasound shows minor myocele of the lower part with normal cranial appearance. Postnatal lateral skull X-ray shows multiple ovoid lucencies with thinning of the inner table of the clavarium clustered within the parietal acromial bones. Most likely diagnosed is lacunar skull. So anterior ultrasound shows minor myocele of the lower cord. Okay. Then postnatal X-ray lateral skull X-ray shows multiple ovoid lucencies with thinning of the inner table of the clavarium clustered within the parietal and acromial bones. So multiple ovoid lucencies and skull X-rays most likely diagnosed as lacunar skull. There are lacunae inside the skull, like small channel inside the skull, so it's called lacunae. Correct. Next paper, Lindsay.